If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, "Walmart has what you want," knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Hi, everyone. This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today, we'll be reviewing 3 anatomy questions. Just a reminder that you can find these questions, as well as many more, on our website at medprep2go.com. If you'd like to get involved with this project, feel free to reach out to us through the website, or you can reach me directly at ted.medprep2go@gmail.com. If you like what we're doing, please give us a review and tell your friends about this project. And don't forget to subscribe to the podcast, as these all will help our progress very much. If you're interested in learning more about me and my books and projects, you can find that at tedxoconnell.com. All right, let's get started with the first question. A 46-year-old man presents to the emergency department for a complaint of dyspnea on exertion for the past 6 days. He reports feeling pressure on his chest and a feeling of lightheadedness, which began 2 hours ago while he was walking. He has a past medical history of hypertension, which is managed with lisinopril. He has a 20-pack year smoking history. Family history is unremarkable. Vital signs reveal bradycardia with a normal blood pressure. Physical examination reveals bradycardia, but is otherwise unremarkable. An electrocardiogram reveals evidence of inferior wall ischemia and bradycardia, indicating dysfunction of the sinoatrial node. An occlusion of which of the following blood vessels is most likely responsible for his current condition? A, left anterior descending artery. B, left coronary artery. C, posterior descending artery. D, right coronary artery. Or E, superior vena cava. The correct answer is D, right coronary artery. The right coronary artery supplies the sinoatrial, or SA node, and the atrioventricular, or AV node. Occlusion of this vessel can lead to bradyarrhythmias and tachyarrhythmias and can result in heart block and hypotension if damaged. Answer choices A, left anterior descending artery, B, left coronary artery, and C, posterior descending artery are incorrect. While occlusion of these vessels is likely to lead to necrosis and heart damage, they are less likely to affect the pacemaker cells. Answer choice E, superior vena cava, is incorrect. Occlusion of the superior vena cava would lead to superior vena cava syndrome, which results in edema in the neck, chest, and face, and also results in pain. The key learning point for this question: The right coronary artery supplies the SA and AV nodes. Question 2. An 18-year-old girl presents to the emergency department with a nosebleed that has persisted for the last 2 hours, despite her attempts to pinch the nose and apply cold compresses. She also reports an episode of bloody emesis. She reports having multiple nosebleeds a day for the last week. Past medical history is unremarkable. She denies cocaine use. Vital signs are within normal limits. On physical examination, she appears pale. An anterior nasal packing is placed, but the bleeding persists. Which of the following is the most likely source of this patient's bleeding? A. Anterior ethmoid artery. B. Greater palatine artery. C. Lesser palatine artery. D. Posterior ethmoid artery. Or E. Sphenopalatine artery. The correct answer is E. Sphenopalatine artery. Epistaxis is classified as anterior or posterior, depending on the source of bleeding. Anterior bleeds account for the vast majority of nosebleeds, and most occur within the vascular watershed area of the nasal septum, known as Kieselbach's plexus. The septal branch of the anterior ethmoidal artery, the lateral nasal branch of the sphenopalatine artery, and the septal branch of the superior labial branch of the facial artery anastomose in this area. Severe epistaxis with associated hematemesis suggests a posterior bleed, most commonly the sphenopalatine artery, the terminal branch of the maxillary artery. Initial management includes tilting the head forward and pinching the nose. Posterior packing and topical phenylephrine may also help with bleeding. In severe cases refractory to all treatment, endoscopic ligation of the sphenopalatine artery is recommended. The key learning point of this question: severe epistaxis most commonly originates from the sphenopalatine artery, representing a posterior bleed.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, our holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at MichelobUltra.com/courtside. Michelob Ultra courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at MichelobUltra.com/courtside for free entry deadlines, prizes, and details.
And the third and last question for this episode. A 62-year-old woman presents to the physician complaining of bilateral wrist pain and weakness, which has been gradually progressing over the past 2 months. She works as a concert pianist. Physical examination reveals positive Phelan and Tinel maneuvers. Manual compression of the carpal tunnel also reproduces the symptoms. Wasting of the thenar eminence is noted bilaterally. Nerve conduction testing confirms compression of the median nerve bilaterally. She elects surgical intervention to relieve her symptoms. Which of the following structures is targeted by the planned surgical intervention? A. Annular ligament of the radius. B. Extensor retinaculum. C. Flexor retinaculum. D. Interosseous membrane of the forearm. Or E. Ulnar collateral ligament of the thumb. The correct answer is C. Flexor retinaculum. Carpal tunnel syndrome results from compression of the median nerve as it travels through the carpal tunnel. It results in pain and paresthesias and sometimes weakness in the distribution of the median nerve, the first 3 digits and the lateral half of the 4th digit of the hand. The flexor retinaculum covers the carpal bones and encloses the median nerve in the carpal tunnel. Carpal tunnel release surgery generally includes an incision into this ligament. Answer choice A, annular ligament of the radius, is incorrect. The annular ligament encircles the head of the radius and stabilizes it in contact with the radial notch of the ulna. Answer choice B, extensor retinaculum, is incorrect. The extensor retinaculum is the anatomical term for the thickened part of the antebrachial fascia that holds the tendons of the extensor muscles on the dorsal forearm. Answer choice D, interosseous membrane of the forearm, is incorrect. The interosseous membrane of the forearm is a dense, fibrous sheet of connective tissue between the radius and ulna. Answer choice E, ulnar collateral ligament, is incorrect. The ulnar collateral ligament of the thumb is one of 2 main supporting ligaments traversing the metacarpophalangeal joint of the thumb. The other is a radial collateral ligament. These ligaments provide static stability to the thumb. The ulnar collateral ligament is most typically injured as a result of forced abduction of the thumb. The key learning point of this question: carpal tunnel syndrome results from compression of the median nerve as it travels through the carpal tunnel under the flexor retinaculum. The flexor retinaculum can be surgically released to treat carpal tunnel syndrome. All right, that's it for this episode. Don't forget to check out our other episodes wherever you like to get your podcasts. And you can also find these questions and many more at medprep2go.com. And just a reminder as above, if you want to get involved in this project and help develop questions for this free online and audio question bank, don't forget to email me at ted.medprep2go@gmail.com. And we'll see you with the next episode. Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.